My name is Maynard Bronstein. I'm a medical oncologist and a hematologist. I have been working at Grande Ronde Hospital since 2011. For several years prior to 2011, I was living in Walla Walla and coming as outreach. But there were two things that really attracted me to come and work here. One is the area. I love the mountains. Outdoor activities. And then the other thing was this hospital. I was really impressed with how well this hospital is run, the staff here, and the facility. When someone has a new diagnosis of breast cancer, the most common way they come to me is after they have their breast cancer surgery. So whether that's a lumpectomy or mastectomy, then based on the results of that surgery, we can make a treatment plan and figure out what to do. With management of breast cancer, I am particularly involved with the medical therapy, so that could include pills, anti-estrogen pills like tamoxifen and letrozole. Also, if chemotherapy is going to be involved, then I help to construct that plan. Very often, I help to coordinate with other services. So for example, after a patient has a lumpectomy, very often they would be candidates for radiation, but usually they'd see me first and I would help set up the overall plan of should we do chemotherapy first, when should you do radiation, and give them choices as far as where they would prefer to go for radiation. Probably the most valuable thing I provide for patients is education, to let them understand what their situation is, what their options are, what they can expect from different options, what sort of standard recommendations are. And then one of the things I really enjoy about cancer care is the patient opinions really matter. I think that's probably true in all branches of medicine, but I experience it in cancer care, that some patients prefer one treatment over another, and I try to let them understand the implications of those choices. I think over the last 11 years, our hematology oncology department really has grown steadily. Now we have our very own infusion center and clinic space. Instead of just me as the only practitioner, now we also have a nurse practitioner, Leah Carpenter, seeing patients. So we've really expanded in the services we offer, the amount of staff, and at the same time we've expanded in terms of the number of patients and the volume of treatments that we're doing. I gotta say, I love my job. I enjoy talking to patients and hearing about what's important to them and what they hope to achieve from their care, their goals for the future. It's really rewarding to be able to work with patients to help them achieve the things that are important to them. A good 8-9 years ago, I was at the farmer's market one morning and ran into one of my favorite patients, and he said, "Oh, it's the bad news guy." So giving people bad news is definitely within my job description. And the first lesson I learned about that is you have to be honest. Because if you're not honest, you're going to get discovered pretty quickly, and then you've undermined trust. So be honest, but being honest doesn't mean being gloomy. Be honest, but then put it in context and say, well, what does this mean? What are our prospects and options going forward? So there's always something that can be done, and it's a question of weighing pros and cons for different approaches to decide what's best for that person. To women who don't want to get a mammogram or want to put off a mammogram, I would say I would rather brush my teeth than have a cavity drilled.
That's good.